Wrist pain, causes and symptoms. Wrist pain is a common condition with various causes. The wrist joint plays a role in basic movements, from texting to writing. When pain occurs, it can interfere with day-to-day activities and even impact a person's quality of life. The wrist is not one joint. Instead, it's made up of several small joints where the bones and the hand and forearm meet. Wrist pain can develop due to a sudden impact or injury. For example, a wrist sprain can cause pain if a ligament is overstretched. This type of wrist pain usually comes on suddenly when the injury occurs. Here we will explore the common causes and symptoms. If any parts of the wrist, including the bones, ligaments or tendons, become injured, it can lead to wrist pain. Wrist pain that is reoccurring is often due to certain conditions such as repetitive stress injuries and inflammation of the joints. Wrist pain can also occur over a long period. What causes wrist pain? Pain may occur for many reasons, whether simple fatigue or an underlying issue. Commonly, injuries to the wrist are the main cause. Squashing the nerves that pass through the wrist can also produce pain. The most common causes include the following. Carpal tunnel syndrome. Carpal tunnel syndrome is a condition that develops when a ligament thickens and puts pressure on a nerve. The nerve is squeezed, which can cause pain, numbness and weakness in the hand. People who are obese or those who have diabetes or arthritis are at an increased risk of developing carpal tunnel syndrome. The condition is also linked with repetitive work that involves lifting, typing or using equipment that vibrates the hand. Osteoarthritis. Osteoarthritis causes inflammation of the joints and occurs when the cartilage that covers the bones wears away. The condition can affect a wide range of joints, including the wrist. Osteoarthritis of the wrist tends to occur most often in people who are middle-aged or older and those with a family history of the condition. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where healthy tissues are broken down by the body's immune system. This can cause wrist pain if the joints in the area are affected. Repetitive motion syndrome. As the name suggests, repetitive motion syndrome occurs from repeating a task over and over again, such as typing or knitting. Overworking the joint can cause it to swell, putting pressure on the surrounding nerves. It can affect many joints in the body, including the wrist. Triangular fibrocartilage complex injury. The triangular fibrocartilage is located on the pinkish side of the wrist. It acts as a cushion and support for the small bones. The cartilage can wear away over time to tear due to an injury. Wrist tendonitis. Wrist tendonitis can occur when the tendons of the wrist develop small tears or become irritated and inflamed. The condition usually occurs due to repetitive movement involving the wrist. Wrist bursitis. Bursa are small fluid-filled sacs that help cushion joints. When this become inflamed, it is referred to as bursitis. This can occur in many areas of the body, including the wrist. Symptoms include tenderness over the tendons of the wrist, redness in the region and swelling. Ganglion cyst. This cause of wrist pain is due to fluid-filled soft tissue cysts that often develop on the wrist opposite the palm, but will occur on the palmar aspect of the wrist. Smaller cysts often tend to hurt more than larger cysts. Wrist sprain. According to the American Society for Surgery of the Hand, a wrist sprain is usually caused by falling and bending the wrist backward when the hand hits the ground. This movement overstretches the ligament. Symptoms of wrist pain. Wrist pain symptoms can vary depending on the cause. Some people may have pain that they describe as achy or dull. Others may have pain that is sharp. The location of the pain can also vary. In addition to pain, other symptoms may develop. Symptoms of an injury such as a wrist sprain can include swelling and bruising. Numbness, tingling, and weakness of the hand might also occur when pain is due to carpal tunnel syndrome. Some people may develop the following symptoms: stiffness in the wrist and potentially the fingers, trouble gripping objects, grasping or holding on may be difficult or uncomfortable, a clicking sound when moving the wrist. This can be more severe after periods of rest. Depending on the cause, symptoms may be mild to start and become worse as time goes on. At first, pain may only occur during certain activities. In time, as the condition worsens, pain might occur even at rest. Numbness can also progress to the point where a person cannot feel cold or heat and may drop things.